Welcome back to Senior Moments, brought to you by the Santa Clarita Senior Resource Alliance here on Santa Clarita's hometown station, KHTS, AM 1220. Today we're talking with Elena, and we're talking about issues of aging, making your own decisions, Medicare planning, and insurance. Elena, as she mentioned earlier, is an insurance broker, agent, and has a lot of knowledge in the Medicare topic that we're talking about today. And just before the break, Elena, you were telling us a little bit more about Part C of the Medicare program. You want to tell us a little bit more about that?
Sure. So Medicare Advantage Plan, Part C, could be an HMO or PPO, and it combines Part A and B, and usually also Part D, which is the medical for the medicines. If you decide to add a drug plan to the Part C, you could do that as well. And then to be eligible for Medicare Advantage plan or parts to get into the A and B into Part C, you need to live in the plan service area. Mm-hmm. You need to be entitled to Medicare Part A, enrolled in Medicare Part B, and continue to pay Part B premiums if you pay them, because when you have Medi-Cal, they cover that for you. And you may also have a monthly premium for the plan. So to get into a Medicare Advantage plan, those are the, to be eligible, that's the eligibility. And most plans, you can have end-stage renal disease at enrollment, and there are some exceptions to that too, some plans.
Got it. Now, as we're talking about the different premiums, again, I'm not really super familiar, and I'm learning a lot today. When we're talking premiums, about what are we talking about? How much are premiums? Just ballpark it. I know each person will be different given circumstances.
I really can't discuss plans or premiums, but every plan is different. It could be zero premium. It could be, $200 premium. It depends on the plan,
all right,
and the area and your needs and so forth.
So each person individually, their circumstances will dictate what their personal.
And you'll have
premiums
options. If you're giving an HMO with a zero premium, then you have to get. If you're in a plan, then you need referrals to go to the doctor, or maybe you want the liberty of not having referrals and you want a supplement plan. So it depends on your needs and your budget.
And when you say depends on your area, you're talking about your zip code, not just California, different counties?
Yeah, so the plans go by county and zip codes, and then maybe you want your doctor to be your doctor belongs to certain medical groups, mm-hmm. and once you know what plans or medical groups your doctors belong in, then you might want to look at those. What plans are in that area and that your doctor also contracts with. So that's important.
And if I were to have two homes, let's say, we would be focusing on my primary residence?
Yes, so your primary residence is the, whatever address you have with, with Social Security, and you could have a separate mailing address, but the plan will be according to your primary residence.
Got it. Right. Got it. So that can be considered when you're going through the application process.
Yes.
So then what are some other options that people can do, or what plans and programs do people have through Medicare to kind of save on some of the costs associated with Medicare? Okay,
so there are certain programs that can help people save on the costs, and that would be Medicaid or Medi-Cal is a joint federal and state program that helps pay medical costs for some people with limited incomes. Mm-hmm. and resources, and Medi-Cals are jointly funded by the federal and state government and administered by each state. It can cover children, people who are age, blind, disabled, and some other groups depending on the state. If people are eligible for both Medi-Cal and Medicare, most of their health costs are covered, mm-hmm. meaning some of their premiums and their co-pays and things like that.
Okay.
And people with Medi-Cal may get coverage for services such as nursing home, home health, and that aren't fully covered by Medicare. And Medi-Cal eligibility is determined by each state, and Medi-Cal application processes and benefits vary by state. Mm-hmm. So you need to contact the state medical assistance office for that. And basically, there's also a program called Extra Help through Social Security, mm-hmm. and it's also based on income too. And if you qualify, it helps you save on your drugs. on your medicines.
Got it. So when we are talking about premiums, we're talking about what it might vary from each person. The idea of having a premium shouldn't scare a person away from the process at all. It sounds like even if premiums might be a challenge for them, there are different programs you're saying that can kind of help them offset
there are
it.
many options for them according to their budget and where they live and what doctors they want. They could get zero, depending. There are many options.
Right.
And I'm sure there's a lot to consider when you're choosing all of these different options.
Yes.
And what are some of the things that you would tell somebody that they should put in their mind that they're considering?
Well, when I meet with beneficiaries, what I tell them to consider when choosing or changing coverage is where are the doctor's offices? Are your doctors, in the medical group in the particular plans? Convenience. Whether if you already have a doctor, but if you don't and you're looking for a doctor, I tell them where the doctor's office is, whether their hours, do the doctors use electronic health records or prescribe electronically, which pharmacies can you use, is the pharmacy in the health plans network. So I tell them to look for convenience, what's convenient for them as far as the doctors and so forth. And if they already have a doctor, I tell them make sure you get a plan that your doctor's contracted with,
Right.
with the medical group. And as far as costs, I tell them to look at the premiums, the deductibles, the copays, all that before they get into a plan. Is there a yearly limit on what, the out-of-pocket? They mostly have out-of-pocket costs. Look at that out-of-pocket too. And that may vary in different and, depending on the plan.
Got it.
And I also talk to them about how well does a plan cover the services you need. For instance, let's say you need a hearing aid. Does the plan cover that, or does it offer a discount?
Right.
So everyone's one-on-one. So when I meet with someone, I want to know who are their doctors, where are they, what plans they accept, and what medical groups they're in. I want to make sure that their medicines are going to be covered in the plan's formulary. Their specialists are going to be and also contracted if you go to different specialists. And so there are many things, but it's really one-on-one.
Got it. So they have to have that conversation to pull out some of those details you're saying also.
Right. Okay. And so basically, does your doctor accept the plan, or the doctors you want to see accepting new patients? Maybe you want a new doctor, and that doctor is not accepting new patients.
Right.
So you need to find one that is.
Okay.
Okay. Do you need to get referrals? Do you have to choose your hospital and healthcare providers from a network? Or you don't want to have to choose from a network? So you're going to talk about all that to determine what kind of plan best fits your needs.
Got it.
Do you need to join a Medicare drug plan? Are your drugs covered under the formulary, like I said? The quality of care, are you satisfied with the care you're getting now? Do you want, you need to change doctors and so forth? And will the plan cover you in another state or outside the United States? Is that important to you? Do you travel? So it's not only looking at, where your doctor is or your medicines, it's also as you're planning to travel with you. Is that important?
Right.
And do you have other coverage through work? Things like that.
Good stuff.
What if I were to say that I'm halfway through, we've chosen a plan, we're halfway through it, and something comes up that was not anticipated, some illness, and it doesn't particularly cover it very well. Can I change coverages mid-term?
If you only have Medicare, if you only have Medicare and you don't have a special election period or a life event that allows you to change, you have to stay in that plan all year round.
Okay.
Okay. But if you have Medi-Cal, even with the shared costs, it doesn't have to be 100%, or the extra help program at any level, it allows you to change plans any month of the year, any time of the year.
And that would be the supplements?
Well, you could change to different plans. If you have Medi-Cal, you could change to a special needs plan or HMO, or depending on your needs.
And if you had already chosen one of those and not a drug plan, can you jump into a drug plan or anything like that? They're pretty rigid on that?
Right. Now, there are other coverage. If you enroll in a plan during open enrollment and then you decide that you want to disenroll, there is the disenrollment period each year is from January 1st to February 14th, where you can choose to disenroll from the plan and go back to original Medicare. And at that time, you could get just a Part D plan, a drug plan. So that would be if you change your mind about your choice during open enrollment.
Okay. And then when you mention an enrollment period, I assume it's a January through December calendar?
The disenrollment period is January 1st to February 14th.
Okay, and the regular standard enrollment period is once you enroll, the full calendar year is the January
1st to December 31st.
Got it.
Right.
Got it. Now, again, for me as a person that's really not familiar about it, I'm learning a lot today, but it sounds like it can be complicated. It sounds like there's a lot of things to consider, a lot of levers to pull, and given each person's circumstance, as you mentioned, will dictate the different levels of premium, what they do have to pay out of pocket, what they may qualify for, special assistance. Tell us about yourself and how you can maybe help someone navigate this conversation, or if the person on the other side of this radio doesn't have all the information they need, are there services that you provide to kind of help at least make more sense out of it offline for other people?
Yes, if someone calls me, because I can't call them, they have to call me first for help. There's a lot of guidelines. If you were to call me and say I need help to navigate through Medicare, I'm turning 65, for instance,
right?
And then you sign the scope of appointment, allowing me to help you with whatever you want to discuss. Then I could come out and meet with you one-on-one and discuss all your needs. And I do a full analysis. I ask you about your doctors, your specialists, if you want to go over your medicines to see what plans cover your area. And we go through all your needs, just like if you need, you want something that covers gym? Do you want something that also covers vision, dental? Depending on your needs, we go through all that to see what's important for you. Do you travel? Or maybe you don't travel, so you don't need that plan to travel with you, and so forth. And then that way you get to see the best options for you. What options are good for you.
That sounds more detailed than, let's say, a coworker or someone they met inside the coffee room or the break room saying, "Oh, I can help you with that." It sounds like you have a little bit more qualifications than they do to talk.
Yeah, I have people that call me and say, "I want the plan that my neighbor has."
Right.
And I say, you could have that plan, but if we sit down and do an analysis of your needs, you're going to come out winning, because then you're going to really get the one that fits your needs. And every year you could review and see if that's still the plan and do that.
Right.
So I think it's important. You could do it on your own. You could do it by calling Medicare. You could do it anyway. But if you call someone with experience, I can't charge a fee. I don't charge anything.
Wait. You said how much did that cost everybody?
As an independent insurance broker agent, I can't charge any fees. If I enroll you in the plan pays me a commission.
Okay, gotcha.
Free.
And
Our favorite amount.
That's what we try to get.
Well, the plan, you don't pay me, but the plans
Through
pay
the
me an
premiums,
enrollment
right.
fee just because they all pay me just about the same for the different plans.
Right.
I contract with all the Medicare plans that I could contract with, most of them.
Good.
So that way I could offer you all the different options.
Right.
And what is better for you.
And what are can you name some of those plans? Is that okay?
No, I can't name those.
You can't? No, it's a secret.
Right. But it's good to know that you have a person in the community, specifically with our Resource Alliance, that will obviously take the time to kind of walk through this path. It sounds complicated on the onset, but I guess once the person understands their choices that they're making, and then they're enrolled, the re-enrollment becomes easier because now you understand what you're already in and all the different options along the way. Is that right?
Exactly, yes. So it's really important to really do the analysis and see what your needs are before you jump into a plan. Yeah.
Good.
So if I were to say that we're retiring, my husband and I, and we're 64, and I'm self-employed, he's got a pension, but we're okay with our insurance the way it is for a while. Should we just not enroll? Should we just forget about it and use our insurance? Or do you suggest that we get in?
So your insurance is through work?
Yeah,
your employer?
through our employer.
So if you're still working and you turn 65, I recommend that you at least tell Social Security that, maybe enroll for Part A, because you're not going to pay for Part A. And then you can still keep your insurance at work. or you could compare. You could compare how much you're paying at work for your insurance and your copays and the premiums, deductibles, compared to the Medicare plans. So if it's a plan through work that maybe you're paying too much and you're going to pay less with Medicare, then you could change the, get the Medicare plan.
What if I wanted all three?
No, you could only, basically, you could have insurance through work and get Medicare, but you can't have, like, for instance, you can't have a supplement and a Medicare Advantage plan at the same time. You can have one plan at a time, either original Medicare with Part D or the Medicare Advantage plan with or without a drug plan, or supplement with a drug plan, but you can't have both when you're in Medicare. Okay. You could keep an employer plan and still get Medicare, but if you're paying both, then you need to consider. Okay. And I tell people that have like federal plans or plans that once you leave them, you can't go back into them, to please make sure to talk to the HR department at your work to make sure that if you leave your work plan and go into a Medicare plan, if you could get back into that employer plan. That's really important, not to drop a plan till you see all your options.
That's
and
very
ask
good
a lot of
advice.
questions.
Yes, that is good advice. So, as the spouse of, and I, in my case, I'm getting the insurance from my husband's work. When I turn 65, I can drop it and he can stay on his, and I can drop it and maybe use a supplement?
Yeah, before you drop it, then you could see what the cost would be if, depending on what you're paying through his insurance. You could see what your options are with Medicare, supplement or parts, Medicare Advantage, whatever, your options, depending on your needs. You could drop the work insurance and he could still stay on.
And I think you already explained this, but if I just wanted to get, after turning 65, if I just wanted to get the drug portion of that added onto, let's say, what I have with my husband's employer, but I needed a supplemental for just drug alone, can you do that?
Yeah, the supplemental is not called a drug. Supplement is a supplement.
Okay.
The Part D is a drug plan.
Okay.
So let's say that you still want your husband to get insurance through work because you're not getting Part D through work, a drug part through work. So you apply for Medicare Part A. Now you have original Medicare Part A. You don't have to apply for the Part B because that one there'll be a premium. Then you could get a drug plan. Just a Part A Medicare, original Medicare with a drug plan.
Sounds like you're the person to go to.
That's right.
Yeah.
That's right. And I would say as you learn more and more down the road to Medicare, there's questions you'll want to ask yourself. There's things you want to consider before enrolling in a plan. Take some time to write down what's important to you as well as any questions you may have. If not already enrolled in Medicare, once you are clear on Medicare basics and all your questions have been addressed, then you're able to take more steps that you'll need to take. Begin by contacting Social Security and to confirm your eligibility with and enroll in Medicare Parts A and B. You'll also want to request your Medicare card. Simply visit socialsecurity.gov online or call 800-772-1213.
And Elena, I have your personal contact information here. Your telephone number is 818-577-5697. You're Elena Perez, healthcare consultant, and they can contact you also by email at ecperez7@gmail.com. That's ecperez7@gmail.com. Does that sound right to you?
Yes, thank you very much.
Okay, great.
Awesome.
Fantastic. Well, you're listening to Senior Moments, and when we come back, we're going to be talking all about the Golden Years Expo. And I think Curtis and I are going to give you some information on that that's coming up. So what are you doing this Halloween?
What are you doing?
Okay. You're listening to Santa Clarita's hometown station, KHTS AM 1220. We'll be right back.
This is Senior Moments on Santa Clarita's hometown station, AM 1220 KHTS. I'm Curtis Woods, and we're continuing our discussion about the Golden Years Expo, which is going to be on October 31st at the Valencia Hyatt from 10 a.m. to 4 p.m. And we're here with Gary Butterbaugh. Gary, tell us more about what's going on.
A lot of stuff going on, I'll tell you. This is the third year for the show.
Awesome.
And I'm glad to say you guys have been in it all 3 years.
Yes, we have.
And the Senior Alliance has been a great supporter. We just are, we put this together to serve not only seniors, but also caregivers, and for people who are planning for their senior years.
Good stuff.
So just about anybody who is either a senior or expect to be will benefit from this show. And that covers a lot of ground because we're all going to be
I was
seniors
going
at
to
one
say,
time.
we'll all be there at some point, right?
Yeah.
Either now or in the future.
Exactly.
But so this is open to all residents, and you saying anyone, and seniors, or even
Right.
adult children of seniors, and
Sure.
things like that.
Caregivers. It's free to the public,
Oh, awesome,
totally free. Even the drawings are free.
awesome.
And we've got some great prizes in our drawings with a grand prize. One person's going to win 500 California Lottery Quick Picks.
Wow,
That's
wow,
500 chances to win over $7 million.
nice, nice.
Fantastic.
Yeah.
That's a reason to attend in itself, isn't
I'm
it?
thinking
Absolutely.
so. Happy Halloween.
So next to the $500 tickets, it sounds like you have drawings. Why else should we attend?
Well, we've got some great speakers covering topics that are really important to seniors and future seniors.
Okay.
We've got people talking about the 4 steps to protecting your assets and independence.
Okay.
Of course, that's Jane McNamara,
Yes,
who we all know.
We all know.
And then also they'll be talking about the monthly cash benefits from the VA administration and how to obtain them.
Good stuff.
We've got somebody that's going to help you understand reverse mortgages,
Okay.
which is can be a foreign language for me.
Right.
And then, of course, overcoming caregiver stress, and I think that's a real important topic.
Yeah.
You don't necessarily have to be a caregiver for that to be an important topic for you.
That's
too.
true. And a caregiver could be someone hired. A caregiver can be a family member.
Absolutely, yeah.
So they need to have that stress
And
covered.
sometimes it's a big strain on family members and a strain on the entire family.
Yeah, I can imagine.
And also, we will have my wife's favorite topic, which is hearing loss and hearing aids.
Nice.
Yeah. And I promised to get one soon, right after we get our color TV.
Right.
So there's actually some health screenings going on there.
We have a number of health screenings. I think we have 7 total that Henry Bale's going to be doing.
Nice.
And everything from top to bottom, just about.
Yeah?
Yeah.
I understand there's blood pressure,
Yes.
glucose,
Glucose,
and cholesterol.
right.
And what else have we got?
There'll be stroke
Okay.
analysis. That's heart stroke, not sunstroke.
Okay.
Right.
Okay.
A little bit different.
Yeah.
And then get hearing, earwax, and
Right.
several other things.
And body composition. What is body composition? What kind of screening is that?
That's a good question. I'm not medical, so I'm not sure. I do know that they have this device that you hold in your hand, and it measures some important elements in your body,
Okay.
and tells you if you're at risk. Tells you if you're at risk for stroke or anything like that.
Fantastic. And this is at the Hyatt Regency.
Yes,
Okay. On our favorite day,
Halloween.
Halloween.
Halloween. Right. Costumes are welcome,
Awesome.
Oh, fantastic.
and I'm sure there'll be a lot of candy there and Halloween goodies for people.
Okay. And we have drawings, like you said.
Right. We have over 15 prizes that are worth $50 or more, and some people, some prize givers go out and stretch it to hundreds of dollars.
Nice.
Oh.
Nice.
Awesome.
Yeah.
Looks like we have 60 exhibitors, lots of information to share with 60 exhibitors, including government agencies and Social Security.
Right.
It looks like it's a little bit of something for everyone.
There's a really good variety of people covering all the very things that are important to seniors and future seniors.
And we will have a booth, the Senior
Yes.
Resource Alliance of
Absolutely.
Santa Clarita Valley.
Got to come visit
And
us.
I'll be there. Laura, Elena will be there as well. And we also have, I see here, Social Security Administration is going to be there. So, and when you go to that booth and you're all confused, come over to our booth and talk to Elena.
Right.
She'll explain everything to you.
Good stuff. Cool.
Fantastic.
All right, well, that's the Golden Years Expo. We have a lot going on. We want to see everybody there. If you're a service provider in the community and you want to get a booth, reach out. Let's get this started.
Right.
And we'll take one more quick break, and we'll be right back.
The website is goldenyearsexpo.com.
GoldenYearsExpo.com.
I don't-
Right.
You're listening to Hometown Station, KHTS, AM 1220. We'll be right back.